Well, good morning, everybody. Thanks for joining me. As some of you might know, I'm Tony from the Mercy St. Luke's Family Medicine Program. And as we do the third Wednesday of each month, give a talk on a different medical topic. Today, we're going to talk about oral health care and aging. And, you know, as we get older, we worry about a lot of things, and certainly one of those things should be how healthy is our mouth. So when I talk about oral health care, it's not just about brushing your teeth. It's about making sure that we are truly paying attention to our teeth, our gums, things like that. But as you can see, you know, one of the concerns is older population makes up the older adults make up the larger proportion of the population. So they said by 2030 or 2035, older adults, meaning 60 and older, are going to be the majority of the individuals in the country. However, despite being the higher amount of population, they typically have the lowest rate of dentist use. And why is that? Well, for different people, it's different reasons. Number one, after some people stop employment, they stop getting dental coverage. So now you're looking at being economically disadvantaged. You might be having to pay for this on your own. Or sometimes with certain healthcare insurances now, like some of the Medicare HMOs now offer a little bit of a dental plan, but it doesn't cover it at 100%. And we know teeth cleanings aren't so bad price wise, but once they want to do x-rays and, you know, now want to do a root canal or even do a cavity, you know, it gets up there. Some people are disabled and homebound. Some people just can't get out. I know that in Lucas County, when I was with another hospital over that way, they used to have a truck that would go around like a van and provide some things, but really you pretty much have to go to them. They're not going to come to you if you're looking for some type of dental care. Some people are in nursing homes, and the dentist really doesn't get there, and it's hard for those individuals to get elsewhere. And a lot of people just get to the point of where, you know what, I'm 70, I'm 80, I really don't care about it anymore. If they fall out, they fall out. I don't get out of the house much anymore. People don't feel the need to see me smile. So I'm just going to let things go. But as it says there's evidence that links oral health to general health, and we're going to talk about that in a little bit. Some of the main problems is tooth loss. So we are doing well in our 40s, 50s, all of a sudden our 60s come around and you know what, I'm having a loose tooth, or this one's starting, my gums aren't exactly looking well, and then you get tooth loss. Some people are willing to say, well, just pull the tooth. I don't want to pay for, you know, dentures or partials or anything like that. The other thing, and this is big for a lot of older individuals, is dry mouth. And one of the reasons that we have dry mouth is because of the medications that we're taking. So we have to take a look at exactly when did this start? Is this dry mouth something that's an isolated incident right now? Or is it ongoing or getting worse? Did I start a new medication? And if I did, is that the cause? Or is it creating a conflict with another medication that I'm taking? So we'll talk a little bit about that. The other thing is dental caries. Dental caries is just a fancy way of saying cavities. So we have to take care of those as well. And then periodontal disease. That's basically another fancy way of saying gum disease. So it's not just about our teeth itself, it's about our gums. Are they receding? Are they changing in color? Because your gums are what keeps your teeth in place, keeps them stabilized. And we're going to talk a little bit more about that here. as well as different types of oral pharyngeal cancers, throat cancer. That tends to be more from people who were long-term smokers, from the South, dip snuff, chewing tobacco, things like that. So basically pertaining to tooth loss, interestingly, the percentage of Americans without teeth has decreased by about 5 to 10%. But as I mentioned earlier, the main causes for tooth loss are periodontal disease or dental caries. So if we're not paying attention to our gums that are kind of like the bridge for everything, or if we're not taking care of those cavities, it's going to lead to deeper problems in the roots of our teeth. And then, of course, smoking and poor health creates tooth loss. I can't emphasize enough that poor nutrition and, I should back up. Pertaining to tooth loss, we all know that it's going to lead to other problems. Number one, poor nutrition. We're not going to be able to chew on that steak. We're going to start, or things like broccoli, cauliflower, carrots. We're going to start to reserve ourselves to a little bit softer foods. Sometimes when we do that, then we're not necessarily getting the protein, nutrients, vitamins that our bodies need. A lot of times too, if we have tooth loss, we're going to have a little bit more difficulty speaking. You might start whistling your S's or something like that if you're missing a tooth. And then social impact. We get very self-conscious, we look in the mirror and go, oh, I'm not going out today. And then one day leads to a week and it leads to a month, and you start to keep yourself more isolated because you're wondering how other people think of your appearance in your smile and that. But dry mouth is very common in older adults. Actually more than half older adults. And like I said, there's things like nerve damage and other diseases, but medications are really the biggest thing. When you have dry mouth, there are over-the-counter things like artificial saliva, oral lubricating gels that can help, but you want to make sure that you're addressing that, because dry mouth leads to cavities and, like I said, gum disease and other things, particularly changes in taste. One thing you can always do for yourself is drink water. And I might say this again a little bit later in this talk, but you want to make sure that you're drinking water that has fluoride. So in this day and age, we always see people like me right now with bottled water, and some people, and they drink it all the time and use it all the time and brush their teeth with it, but it doesn't have fluoride. And fluoride is the one thing that keeps our teeth and our gums healthy. So you want to make sure that you're aware of that. Dental cavities, like I said, 50% over half of people of the age of 65 are going to have cavities. And it's basically, we all know this since we were in grade school. It's caused by tartar and plaque buildup, which leads to tooth decay. But there's also a risk factor for systemic disease. And I didn't realize that until I started, giving these talks, and I've been in the medical field for 35 years now, but I have probably seen 8 cases of people that have had heart attacks and strokes directly related to poor mouth care. So people that have a lot of dental loss or have not been to the dentist and they're just totally ignoring it. They're not brushing, and somebody, we tend to call it yuck mouth, has a really bad dentition. This can cause the nerves and the roots to start to develop disease and spread. And believe it or not, mouth care can directly be related to heart disease and stroke. So of the 8 people that I've seen, 6 of them had heart attacks and 2 of them had strokes. strictly related to poor mouth care. So it's something we want to definitely take care of. Periodontal disease, like I said, that's just a fancy way of saying gum disease. It really puts people at risk, as I said, for heart attacks and strokes, and treatment improves other diseases. So once we start to identify that there's a problem and we take care of it, it actually is going to have a correlation or a direct link to some of the other illnesses or diseases we have going on. And as your mouth care improves, so does the rest of what you're dealing with. The oral health care, pharyngeal cancer, again, throat cancer, these, where it says 54,000 cases per year and 11 deaths per year, that's actually gone down. So people have done a better job, I think, because we know the risks and dangers of things like smoking and chewing tobacco, and we also know that there's a lot of different products out there. We'll talk about those here in a little bit, but over the age of 60s, when you start to see a lot of this. But again, I mentioned smoking in that a few times. Also, alcohol is something that is very, very significant to look at when we're addressing these kind of issues. So 5-year survival rate. That means from the time that you've been diagnosed with oral or pharyngeal cancer, how long you're going to continue to live. So you can see just over half of whites from the time they're diagnosed 5 years later are going to continue to live, but not so much for blacks or African Americans. My take-home message with this is the warning signs. So taking a really good look at, we brush our teeth, we rinse, we step back, we smile into the mirror, but we really need to get up close. And sometimes even when we're there, taking the flashlight on your camera, on your phone or something, and just taking a good look. Are we having any sores in our mouth? Again, we have canker sores and cold sores and, things like that, that can come and go. But is this something that's been hanging around for a couple of weeks or longer? Are there white patches, red patches, dark patches? All those different colors are going to signify something a little bit different. The white ones typically tend to be early stages. Red is kind of the middle stages, and dark is things have been going unattended to for too long. Is there repeated bleeding in the mouth? I'm not talking about where you've been brushing your teeth and you hit your gums and then all of a sudden you go to spit and you see a little bit of blood. I'm not talking about that. Is it something that is just routinely happening and you haven't changed the way you're brushing your teeth or caused any injury? And then the other thing is, it may not necessarily be something that you see, but something that you feel, a loss of feeling or numbness or even pain in your mouth. Again, I go back to what I said earlier. Is this an isolated incident? If it is, that's one thing. If it's a pattern or something that's becoming more frequent or staying around a little bit longer, is when we have the most concern. So now we go on to maintaining our dental health. And this is something that, we've been taught since we were in grade school. I've said this three times, but I don't know, maybe it was just my school. When we were in first grade, we get these toothbrushes, we get this toothpaste, and they teach you how to properly brush your teeth. But then they gave us these little tiny red pills. I don't know if anybody else got those, and then you had to, chew them or something, and then you had to smile, and it showed how well you were brushing your teeth. It was showing up red. You remember? Yep. Thank you. I'm glad I'm not the only one.
They showed up what you meant.
Exactly. These little red patches or white patches would say, well, this is where you did well, and this is so, not just going back and forth, but up and down and all these things. But making sure that we brush twice a day. I know it tends to be me. Sometimes we have to get up, we have to get going, we're in a rush, or we change our routine for that particular morning or that particular evening, and we forgot to brush. But trying to brush twice a day. The other thing is flossing daily. It used to be back in the day, there was only one kind of floss. You had this little box and then you open it up and there's this string and you got to tear it off about this long, wide your fingers. But now they have picks and everything. And I'm like, to me, picks are a great thing. However, with picks, it's not just about putting it in your teeth and going back and forth. It's putting it in your teeth and going side to side as well. And the dental hygienist told me that it's not just getting in between your teeth, but on both sides of it. So you can still use the floss, but or the picks, you just got to make sure that you're trying to wind a little bit in front and wind a little bit in back to get things. The other thing is using soft bristled toothbrushes. Again, back in the day, there was hard, medium, and soft. And we always thought hard or medium meant that it was going to scrub things a little bit better and work a little bit harder for us. But in actuality, that damages our teeth. It starts to wear down the enamel. And so we want to make sure that we're using a soft bristled toothbrush. Yep. Excuse me. Another thing with soft bristled toothbrushes is they fray very easily. They wear out very easily. So when you go to the dentist twice a year, they give you a new toothbrush, but chances are somewhere in between, probably around the 3-month mark, you should be replacing your toothbrush, because when you start, instead of them all being like this and they start to fray a little bit, it's not going to provide as good coverage or its intended use.
Could I ask a question?
Yeah.
My dentist says it's the battery operated.
Mhm.
What do you think about that?
We're going to get to that.
Okay.
Thank you for bringing that up. So using fluoride toothpaste and fluoridated water. It used to be, keep going back to the good old days, there was just, when you went to the grocery store, here was the toothpaste, here was the toothbrushes, maybe 1 or 2 different types of dental floss. Now you go and there's almost a whole aisle dedicated to these things. So you have sensitive toothpaste, extra whitening toothpaste, different flavored toothpaste. Now you see the charcoal toothpaste out there. Not recommended, but you just have to figure out what works best for you. And maybe that's a conversation you have with your dentist or your dental hygienist when you go to get your teeth cleaned. And the other thing is making sure that even with your existing teeth, or I should say beyond your existing teeth, making sure that your dentures and your partials get as much care as your natural teeth. Young lady brought up a great point about battery operated. For some people, as we get older, we don't have that dexterity of being able to go back and forth or being slightly vigorous or going up and down. So using the battery operated one is a very, very good thing for individuals who don't have that dexterity. It'll do the work for you. They typically tell you to brush your teeth for 2 minutes. Some of those battery operated ones actually have a timer on it that when you turn it on, it'll turn off after 2 minutes. So you know exactly how long. I mean, this is the world in which we live in now. So just making sure 2 things. Number one, the battery operated ones like the Oral-B water picks and all that tend to be very expensive. I've seen them run $100, $200, and that's just for the unit. And then you have to buy the removable heads. And then the other thing is making sure that you are not trying to extend that for too long, because again, the bristles get worn, they don't work as well. Avoiding tobacco and alcohol. And again, seeking medical attention if you're noticing any type of sudden changes. Again, difference between an isolated incident and a pattern. I wouldn't worry about one thing, but keeping an eye on it for a few days or week, and then after that, having to make the call and visit the dentist twice a year. Some of this might seem like it is common knowledge. Some of it's a good review, but the other thing is just making sure that we know, and my take-home message is there's a direct correlation between how healthy our mouth is and how well the rest of our body will continue to be moving forward.